On that note, let's bring in our guest this morning, Winnie Syombua, the gender leader, the journalist for human rights. Good morning, Winnie.
Good morning, Eric.
Thank you very much for joining us. Welcome to the Situation Room.
Thank you very much. I'm happy to be here.
And it's good that we have you here today on this first day of the 16 days of activism against on gender-based violence. So looking at the instances that we've seen in the country, especially during this time of COVID-19, from a journalist point of view, I've got to ask you for the numbers and the statistics. What numbers do we have coming from the country that have been reported?
I'd have to say that, first of all, there has been a problem in terms of consolidating the numbers because of the secrecy that shrouds issues to do with gender-based violence. Few people want to come out and report because they fear that they will be stigmatized if they speak out. If people get to know that they're victims, they fear that they might be blamed instead of getting sympathy. And so the numbers that we have are not that clear, but at least what I have right now is that in the month of May, for instance, we had about 753 cases reported, 33 of which were reported by men. We had in June 785 cases. In August, we had 810 cases. In September, we had 966 cases. And what we're seeing out of these numbers is that we see that there is also a high reportage of issues, of gender-based violence cases by men. Because in June, for instance, it was 33%. In July, it was 43%. In August, we're seeing 38% of the cases being reported by men. Out of these cases, we've got in the month of August, we have 631 cases involving physical assault, and 966 cases were about psychological torture, which is a form of gender-based violence, but it's rarely reported because many people tend to think that it's normal for people to have a spat between themselves, but then the psychological effects of that have got far-reaching consequences on human life. Other than that, you properly alluded to the rising number of teenage pregnancies. The first instance of teenage pregnancy was reported in Machakos County, and at first I think it was picked by Twitter, and the stories around that was that it was a little bit sensational, and people thought that the numbers were a lie, but if we look at the numbers we have currently, the month of, I think, September, the numbers that we have on teenage pregnancies were 3,964 girls under the age of 19. That is a large number, and those are the numbers that we know. Remember, a lot of girls who fall pregnant do not attend antenatal care clinics. So the numbers we have been picked from those that have attended the antenatal care clinics. So if we were to pick the rest of the numbers of those who haven't gone but are still pregnant and are sitting at home, it would escalate to possibly up to 5,000 to 6,000 children.
Let me ask this question, if I may. Would you say, just anecdotally speaking, of course, that the numbers that you don't capture, just by virtue of the nature of what we're discussing and how it is people handle it, the stigma involved, the issue of parents involved, would you say the numbers that we don't capture are likely to be more than the numbers we actually capture?
Yes, I would confidently say that the numbers we do not capture are more. Again, as I said in the beginning, there's a lot of stigma that surrounds gender-based violence. And gender-based violence varies. It could be battery at the home front, it could be rape and defilement, or it could be psychological torture. So issues to do with rape and defilement, and of course domestic violence, nobody wants to speak out. And so they'd rather heal from the hidden spaces of their homes instead of coming out to say that I have been battered, I have been raped, I have been defiled. And so with that secrecy, a lot of statistics get lost, and it's the highest number of statistics that gets lost.
So what are we looking at in the country now? If we're looking at gender-based violence, the conversations that have been previously had, if we were to give a scorecard in terms of, I mean, yes, declarations have been made in terms of what has been said would be done. If we were to give a scorecard of what the country looks like when it comes to these discussions, what are we looking at for Kenya?
I think a scorecard, I wouldn't give a scorecard in a general sense of view, because I would like to recognize the efforts that the civil society has put in place towards eliminating gender-based violence, and the government has also tried to put in place certain measures to see to it that gender-based violence is eliminated. So with the civil society, I'd say that their efforts can possibly be rendered up to about 60%. When we come to the government, I feel like the efforts the government is putting in place is up to about 30%. So I feel like there's more room for government to do more. Putting in place, we've got really sound policies and legal frameworks as a country that support gender-based violence. But then again, when it comes to the implementation, there's a bit of a problem. And I see a space for government to come in and act more proactively towards ending gender-based violence. I'd also say that there's need for concerted efforts by the government to fund initiatives that have been put in place both by the civil society and by the State Department for Gender, funding them properly so that we can address gender-based violence conclusively. It is a scourge, to be honest. And for me, I always say that it's a shame that in 2020 we have to be speaking about gender-based violence in the terms that we speak about it.
Why do you say it's a shame?
It's a shame because you would want to imagine that as a country we have evolved in terms of our thinking, in terms of our cultures, to the sense that we have now recognized women and girls as an important part of society, and to be in a place where we know the issues that bring about gender inequalities between men and women. Those are things, I mean, I would want to imagine that we've gotten to a point where we have a better understanding of those issues. And so with that understanding, then it comes about that we would be keen on eliminating gender-based violence based on the understanding of the issues that I'm talking about. So that's why I feel like it's a shame.
You know, gender-based violence in this country, if I may just chime in, focuses its attention on violence that men meet. Well, that men actually perpetrate and focus on women. However, gender-based violence should also refer to violence that women also mete out to men. Now, why do I bring this issue up? What I actually want to ask, that was just a by the way, what I actually want to ask is this. From the statistics that you have gathered over time, would you say that matters of gender-based violence are actually managed and handled in this country by everybody else other than the government?
It would be unfair to say that the government is not handling matters to do with gender-based violence. I mean, as I said, there have been efforts by the government to put in place some structures.
I think I didn't ask it properly. The bulk of the efforts being made, that's what I meant to ask. Yes. Are they being managed by everybody else other than the government?
Yes, I would say so.
All right, now tell me about these efforts that the government has made so that I can hear it. Apart from policies and so forth, what else have they done?
Well, I think the government has, at the upsurge of COVID-19, we saw the government putting in place a hotline, which also had they're called telecounselors, who would support victims who would call in to report cases. And it also acted as a link between law enforcement and healthcare service providers for victims. And I think some of the ambulances there were ambulances that were set aside to perform rescue services for persons who would call in and say that they've fallen victim of gender-based violence and were requiring medical attention. Other than that, we've seen a little bit of county governments coming in and putting in place, like Makueni County has a rescue center, a safe house. We also have Kilifi, Kwale, Mombasa counties putting in place government-sponsored counselors who have been counseling citizens were calling in from those counties seeking healthcare support services. The National Government Affirmative Action Fund has been distributing dignity kits to people who are adversely affected, and also distributing the dignity kits to women in informal settlements in rural areas and those in need in other spaces in the country. Other than that, also we have declarations that have been made. We have, I think it is in the last month, yes, we had a framework developed to address the rising numbers of teenage pregnancies, and also to address a reintegration plan back into schools for those who fell pregnant and are in the classes that require to go back, that have gone back right now, and in anticipation of schools reopening in January as well.
Then I would say, actually, then with all those things that you've said, to answer CT's question, if I were to answer it, I would say, if we compare what the government is doing, has done, blowing hot and cold or whatever, the government is actually doing more than the community is doing. We can say the government is putting in place the measures, the mechanism, the policies, the frameworks to address gender-based violence, but gender-based violence is being committed in the community, and the community is not doing as much in its work of forestalling or even addressing gender-based violence. Just like we're saying, how many cases go unreported and why? Because of stigmatization. Stigmatization, community. How many cases are being perpetrated in the community? The government is doing a lot more than the rest of us are doing. And we should also make the similar kind of effort if we are to address this.
Indeed, I don't think the government has done absolutely nothing. When you talk about ambulances and you talk about centers, okay, how many centers do we have around the 47 counties? How many ambulances have they issued? See, certain things happen in the great city of Nairobi, but as we argue, that health is a devolved function, so you would assume that I'm using health here because when people suffer from this perpetration, they usually end up in health
center.
Yeah, exactly.
Health center.
Now, the social element of it, what are we actually fighting? Because we are looking at the consequences of some action, but what really is our problem? What are we dealing with? Why is it that gender-based violence becomes a hot topic as it is? And it's predominantly men perpetrating the crime against women. Why is it so? Some communities think that battering women is actually just ordinary sport. It's not something that you should take very seriously.
Some communities feel that if they're not battered, women in these communities feel that if they're not battered, that their husbands don't love them. I mean, there's so many things. The dynamics of this are quite, and I'm sure you've run into things like this in the work that you've done as well. But then as we're asking the question, going through and saying, okay, with what we have today, with policies that are being put in place, I mean, are we, with what government has done and what government promises to do and what civil society is doing, can we get to the place, from what you see, whereby we are so comfortable with the conversation that we can say enough has been done? Because it's not just putting policies in place. It takes a total mind shift from what we're just talking about now. Total mind shift in some areas to say, you know what, actually, it's not the best route to take to cobble, to beat somebody up and that kind of thing. Is not. There's a mind shift element here. There's a policy element here. There is an education element here that even from the age of 6 to 7, that young girls and boys need to understand what it is to have a right not to be battered, whether you're a girl or a boy. So can we get to the point where we're saying that we are so comfortable to have that conversation across the board, young to old, across social strata? Can we do that?
Winnie?
Yes, I do feel that we can get to that point, because if you look at the efforts that have been put in place, I think about 10 years ago, the conversations that we're having right now are not conversations that were being had then, especially regarding gender-based violence. There has been a lot of concerted effort towards creating awareness, but I think there's need for more to be done, to have continuous public education that is inclusive, that includes both men and boys, so that we can challenge the cultural perceptions that predisposes women and girls to gender-based violence. And again, yes, I would like to agree with Citi that there's also the perception that gender-based violence is meted out by men to women. But if you look at the statistics I gave, for instance, you can see that there's an increase in the number of men that are reporting. When you have a number like 48% of a particular number being men who've reported that they've been battered, it means that the conversation is now beginning to shift, that men are feeling like there's an opportunity for them to speak about what is affecting them, that there's a space for them to be heard, and it can be safe. So through the continuous engagement with the public, with the communities, and bringing on board the so-called opinion leaders, including the church, the chiefs, men who are survivors of gender-based violence, I think we will get to a point where now this conversation shifts the arena, so to speak, and once there's a realization that it's a scourge that's affecting all genders, I think then the efforts will then shift towards looking at it more than a women's issue to a social issue that is affecting human beings and not just one particular gender.
You know what I find interesting is how it is that the thing that would actually matter the most and that would bring long-lasting change in the future isn't part of the conversation ordinarily. And Ndu has brought it up. We discussed it in a previous discussion in the show. This is ensuring that from a very young age, within the curriculum, not just as within the curriculum, these are things which are taught because they are part of life skills, so that people understand. They do because remember the backgrounds people come from and how much it influences people. It is understood that education will bring a balance to this. You mix with other people, you get to learn things you didn't know. This should be one of those things so that it becomes normal for you to think that way. Teaching grown-ups who have fixed ideas which are advantageous to them.
Yeah.
And when you have a male-centered society like ours, yes, they will listen, they will hear, but they won't change much. If they change, they'll change ever so slightly just so that they look compliant.
It needs to start earlier.
Much, much earlier.
I would like to imagine that the experts on education, those who look at curriculum and develop curriculum, would have had this kind of conversation. What is it that would make it so slow to get this kind of programs adopted, even by the government, and included into the curriculum? What is it? Is it the same thing, the patriarchy, that then still fights back, still pushes back, and still finds, no. If we start mainstreaming this conversation and inculcating these things into children, then we're going wrong?
It's very possible. I can't give a direct answer to that, but what I do understand and what I do know is that the situation that the social construct that we have in this country favors men enormously. And if men are still at the hierarchy of power, they will be very slow to want that changed. Because what many men interpret, and I'm speaking anecdotally here, as anything, the moment you mention the word gender, what they hear, you mentioned gender,
Woman.
they hear,
It's woman.
yes, and a threat to manhood. Okay? So their reaction to anything that is gender-based doesn't receive the best of receptions, unfortunately. So moving forward swiftly, it is unlikely to see the light of day if we push it in an education system. But yet, it must be.
It must get there. Again, Winnie, if we just look at the numbers that you gave us, the statistics, May, the number of reported cases, 753. By the time we're getting to September, that has risen to 966. In between this, the matter has even gotten the attention of the president himself, who during one of the addresses on COVID-19 came out and said, I am directing that action be taken to reduce and curb the rising cases of of gender-based violence. But we still see that rising. What would be the cause for that? Is it that, it was just words that were uttered by the president, but those that were supposed to implement it then didn't have the necessary tools and wherewithal to go ahead and make sure that this stops? What could be the reason for this?
There are various reasons. One is this is not a crime that is committed in the open. It's not like robbery. It's not like, murder, for instance. Some of these crimes are committed in the secrecy of people's houses. So being able to track and trace requires, again, what we've talked about consistently, which is the reporting structures being put in place. And so long as people are not coming out to report, then the numbers will keep rising without anyone wanting to take up, the legal measures or the law enforcement measures that have been put in place. That is one. Secondly, COVID has put us in a very precarious position because during what I'd like to call normal times, you've got everybody up and about in their business, and there's little interactions in the home front. Children are in school. They're not playing about in our estates or in our homes, unattended. Parents are at work. But now with COVID, everybody has huddled together in their home space. We've brought the perpetrators closer to their victims without an avenue for there to be, space for this person to escape. If you look at the numbers that were reported between May and August, when we were in the spike of the lockdown, you will realize that they're also higher compared to the months before then. And this is because people couldn't go to, you see, in Kenya, if you're living in the city, your escape route is usually to go to your village. Borders were closed. Nobody could leave the city to go to their village and hide there. You still need to eke a living. Children are in the close proximities of homes. They're not going to school. They're playing about. The rapists and other people are luring around, and they're just lurking around, waiting to lure these children into dens and rape them. Those are some of the challenges that make it difficult to track and decrease the number of cases. And then also there's a challenge with there being lesser numbers of, there's a capacity gap here in terms of some of the duty bearers that have been asked to take up the responsibility not being aware in terms of what to do. So there's need for capacity to be built of the police officers, of the law enforcement sector in general, for them to know how to address and handle some of these cases that might be reported to them.
Winnie,
And apart from
thank you very
capacity,
much.
there's
I think it's a conversation that we're going to have even in coming days. Winnie Syombua is a gender lead at the Journalists for Human Rights, and thank you very much for speaking to us as you begin the marking of these 16 days of activism on gender-based violence. Asante, and we wish you a good day.
Thank you very much. Have a lovely day too.
Thank you.